My name is Dr. B. Hill. First of all, I'd like to thank each and every one of you for making the first step forward for your treatment. And I'm here today to explain a little bit about our program. First of all, we do random drug screens just like any other doctor's office does. After all, we are a doctor's office. But the one thing that's perfectly different in our program than there is in other people's program is that we allow you to do the drug screen at home in the privacy of your own bathroom with nobody else looking over your shoulder. After all, I don't know very many people who pay to cheat. Second of all, once you finish that, all you have to do is put it in an envelope and mail it back to us. And then we'll get back to you if we need to. Second of all, which is, I believe, is really the most important part of our program, is that you participate in a mandatory weekly meeting. Now that meeting takes place every Thursday at 10 o'clock in the morning. And what's really nice about it is if you can go ahead and be with us for that meeting at 10 o'clock sharp on Thursday morning, after we stop recording, we open it up for open mic. And it's very interesting because you get to listen to a lot of things that other people have to say. You can ask your own questions and you can make your own comments, which I think is important. Now, we do realize that people do work. They have children and they have things that they have to do, and they may miss an occasional meeting on Thursday mornings at 10 o'clock. So what we do is we record the meeting, and you can watch the meeting anytime after 12 o'clock on Thursday. You'll answer a few questions, maybe 4 or 5. They're real short, they're not real difficult, and you'll push the send button and it'll come right back to us. Now let me explain to you that there are ways that go ahead and watch the video. And when I speak to you live, I will explain to you exactly how to get in to watch the video. Now, our program also requires that you have a counselor. Now, I'm not going to ask you to go out and get a counselor. We actually have a counselor, and she's there so that you can talk to her if you want. Now, she's a board-certified counselor, and the best part about her is she's also an ordained minister, and she's a lot of fun to talk to. So please feel free to go ahead and call and get her on the line and talk with her and maybe pray with her. The next thing is that we do have a periodic review. Now, you'll never know exactly when that's going to happen, but all of a sudden you'll get a thing that says receiving your periodic review. And we'd like you to go ahead and answer the questions, maybe make some comments, and send that back to us. One of the other things is that we know we're not going to go ahead and pick up the phone and call you and tell you it's time to go ahead and reduce your medications. And the reason for that is that if you're doing wonderful the way you are, then we don't feel like you really need to reduce your medicine. And besides that, there is no medical foundation out there that says that you're required to do that, or it's better for you to reduce your medicines. But I will tell you that if you decide that you want to reduce your medications, all you have to do is call me, and you and I will work together to reduce your medications. But remember, you don't want to try to reduce your medications on your own, because that's when people start to get into problems. So just pick up that phone and call me. The other thing is, do you have insurance? If you have insurance, most insurance policies, most Medicaids will pay for your medication, which is absolutely wonderful. But if you don't, there is a wonderful card out there called a GoodRx card. And all you have to do is go to the App Store on your phone and download the little app on your phone, and when you go to the pharmacy, just show them that little app on your phone, and that reduces the cost of the medication by about 70%, which is really great. Now remember, most important thing for you to do is to watch your video or attend our meetings, which are mandatory every Thursday at 10 o'clock, or tune in at 12 noon or after to watch the videos. Remember, whether you decide to join our program by the week, by every 2 weeks, or by the month, you still are required to watch those videos on a weekly basis. Finally, again, I'd like to welcome you to the program. I'm very proud of you. You've taken a huge step, and I'll be with you every step of the way. Welcome, and I'm proud of you.